For the past 10 years, I've come to Africa by myself in a very quiet way. Yes, as a United States Senator, but not really. More as a physician on medical mission work to deliver health care to people all over this continent. Most of the time I have spent maybe a week, 2 weeks, maybe even a month in places like the Nuba Mountains, in rural southwest Kenya or the southern Sudan. Now that I'm out of the United States Senate, I want to take some people along on that journey, people who might not otherwise have the chance to come to Africa. I want to introduce them to the realities of global poverty and extreme difficult disease like HIV/AIDS, malaria, and tuberculosis. I hope people will join me on this journey over the next several days. There are basically three things that we as a nation, as a society can do. First is education, second is resources, and then third, make sure the resources get on the ground. We need to educate ourselves. We need to talk to people who have been to Africa. We need to understand what causes global poverty, what causes extreme poverty, what causes HIV/AIDS, malaria, tuberculosis, and how we treat that. Second, resources. The American people are some of the most generous people in the world, and we know that. And the American taxpayer has been generous. But we are going to need continued resources to take on those evolving infectious diseases like HIV/AIDS and malaria and tuberculosis, and indeed to fight poverty right on the ground. And third, and this is what the American people want to see, they want to see that those resources get to local communities, communities that we'll be visiting over the next week and a half, communities that you will see those root causes of poverty, those families that are being devastated by disease. So education and resources, and then making sure that money is accountable by getting it on the ground. If there's one thing that we have demonstrated in politics recently is under George Bush's leadership that Africa is important. The American taxpayer has been very generous, initially with $15 billion and then now with up to $50 billion to fight things like HIV/AIDS, malaria, and tuberculosis. But we need to transform our foreign aid. We've taken a first step with the creation of the Millennium Challenge Account, a joint public-private partnership that demands accountability for that foreign aid. The key word is accountability of foreign aid. And we can do that. We need to continue to do that. We need to put the pressure on our public leaders, our senators, and our congressmen to make sure that that foreign aid is used in an accountable way. For the past 10 years, I have been on the ground, in clinics, in hospitals, delivering care as a physician. I've seen how HIV/AIDS and malaria and tuberculosis are ravaging societies, hollowing out those societies. I've been able to operate in the southern Sudan, in the Nuba Mountains in the middle of Sudan, in southwest Kenya, in Maputo, Mozambique, and I've seen the range of what is needed. What the American people need to know is that their dollars are making a difference in reversing the course of HIV/AIDS and malaria and tuberculosis. There are 28,000 children who are going to die over the next 24 hours, most of them in Africa, in this part of the world. The good news is it doesn't take heart transplantation to cure them, to treat them, to prevent those deaths. Indeed, 2/3 of those 28,000 deaths over the next 24 hours can be prevented by simple things like clean water, like vitamin A, like vaccines. These are cheap, they're inexpensive, and we know that they work. For more than 10 years, I've been on the ground in Africa, not as a United States Senator, not with all the celebrity and the cameras there, but very quietly, working one-on-one, helping build a hospital, helping dig a well, helping build those little adobe mud huts. Yes, doing surgery as well. People ask me all the time what they can do, and I would say first, one, learn about Africa. Learn about the problems, how many people die of HIV/AIDS, malaria, tuberculosis, what it does to a family. Number two, I would support our political figures who understand the developing world. And yes, we're talking about Africa now, but it might be Bangladesh, it might be parts of Eastern Europe, but learn about areas of extreme poverty, what causes it, and share that information with other people. Follow us on our journey this week. And then third, support things like the Millennium Challenge Corporation. Things that are public-private partnerships put forth by government that demand accountability for foreign aid And number 4, do simple things. Go on the website tonight and find malaria, and to an organization like Malaria No More, give $10. That $10 will save a child's life.